Hello everyone, welcome back to MISI Care Online Health Education. Today we talk about stroke symptoms and prevention. Now, some facts about stroke. You can see from the slide here, 1 in 6 people will get stroke in their lifetime. That is a very significant number. And the whole world, worldwide, we have about 15 million people suffering stroke each year. And there are about 26 million stroke survivors living among us. And stroke is a leading cause of death for people above the age of 60. And high blood pressure is the commonest and important cause for stroke. Fortunately, about up to 80% of stroke is preventable by healthy lifestyle, control medication, control our disease, chronic disease like hypertension, diabetes, complying to medication. So within 80%, we should be able to reduce the number of stroke if you really comply to the advice. Now, what about Malaysia? It's about 50,000 of new cases of stroke every year in Malaysia. And these 7 out of 10 stroke survivors, they become dependent to some extent, requiring people to assist in their daily activities. Some even severe have to stay in a long-term institute. Don't think that stroke is for elderly, for older age group. In fact, in Malaysia, 40% of the stroke patients are actually below 60. So it's not pertaining or specific for elderly, but any age group, even 40 plus, 50 plus can get stroke as well, right? And because of that, you see in 2018 Malaysia figure, stroke is the 3rd commonest cause of death in Malaysia. So let's look at the definition of stroke. In medical term, ischemia means that impaired blood circulation to particular tissue or organ. Now, when this impairment of blood circulation to particular tissue, in this context, we're talking about brain cells, impaired to the extent that causing the death of the cells, brain cells, then we call stroke happen, right? And we try to change the public perception about stroke to instill more urgency and emergency in it. We try to call it brain attack. Just like heart attacks, everyone is well educated that heart attack is something major, need to be attended immediately in hospital setting. So we try to instill new terms, say we call it brain attack, because stroke, as important or as urgent as any heart attack, should be attended immediately in hospital setting. So this new term emerging now, we call it brain attack. So you can see from here, there's a blood clot affecting this whole area, causing the impaired blood circulation and cause cell death in this area. Hence, it's called stroke. Now, simple pathophysiology, there are so many substance, chemicals released in the stroke area or tissue. But just some facts about timing. When there's a blood flow interrupted, neurological metabolism is altered in 30 seconds. Now, if it's still interrupted for 2 minutes, metabolism stops. And this interruption goes on beyond 5 minutes, cell death occurs. That explains why stroke is an emergency. That's why we should call it brain attack, right? You can see from here, from this illustration, is sudden blockage to this area. The cell death expands if no intervention. There are 2 major types of stroke. One is called ischemia stroke. Ischemic stroke is something like impaired blood circulation due to the blockage. Second type is called hemorrhagic stroke. Now, ischemic stroke contribute about 85% of the all stroke whole world, and hemorrhagic stroke is about 15%. And look at the ischemic stroke. Basically, there are 2 types of subtypes of ischemic stroke. One is thrombotic. That means it's already unhealthy vessels, arteriosclerotic vessels. The plug become ruptured and cause sudden blockage and block the subsequent blood flow to the distal part of the vessels, right? Whereas the other embolic stroke means that there's a blood clot flowing from somewhere more proximal to that particular brain area and cause stroke. Now, this is a CT scan to differentiate these 2 types of stroke. This ischemic stroke, you can see that this whole area, in darkened area, the cell die together with surrounding edema or swelling of the brain. Whereas hemorrhagic here, there's a blood. In CT scan, blood appears as a white contrast here. You can see the white color actually is a blood inside the brain. So this is a hemorrhagic stroke. In hemorrhagic stroke, the CT scan changes is immediate, whereas ischemic stroke, in CT scan, early part of the few hours of the ischemic stroke may not be visible so clearly in CT scan. That's why we may have to repeat it if we still suspect it's ischemic stroke, or we can choose the other modality like MRI brain. Right? So ischemic stroke, we talked a little bit about it. Most patients with ischemic stroke do not have any decreased level of consciousness in the first 24 hours, may not have, and the symptoms of, for example, the weakness of the left upper limb become more obvious for the next 72 hours due to the swelling of the brain we call cerebral edema. Now, embolic stroke, which is part of the subtype of ischemic stroke, this, we call it embolus, come from other part of the organ, commonly found in carotid area, over the neck, big vessels, because of the high cholesterol, cause a blockage of the carotid, and this arteriosclerotic plaque may dislodge or form a small blood clot and dislodge and flow to the brain and block up the brain vessels. And it can come from the heart, the other common place, especially those with the abnormal rhythm of the heartbeat, we call it arrhythmia or atrial fibrillation, which is most common, and dislodge the blood clot and go to the brain. That's why in atrial fibrillation patients, their risk of getting stroke is very high. We are talking about embolic stroke, very high. You can see from this diagram here, the blood clot come from somewhere, distant, then come and block the vessel in the brain. Now, hemorrhagic stroke contribute about 15% due to the abnormal or unhealthy vessels and cause stroke, right? We see those in the teens or 20s, they also have the bleed in the brain that is due to the abnormal formation of the vessels we call aneurysm and rupture aneurysm. That is commonly seen in the very young age group. You can see the diagram here, the vessel suddenly rupture and cause impaired circulation to the brain. And this bleed can be very massive. Who are the people who tend to get stroke? So we're talking about risk factor now. Non-modifiable, which we can't change the cause, like for example, aging. As we age, the chance of us getting stroke is higher. Gender, recovery-wise, women tend to not do so well for stroke and they tend to die because of the stroke. Certain race have higher risk of getting stroke, and some family history as well. How about those modifiable? Now, hypertension is the commonest cause of stroke and as a major risk factor for stroke. So as long as we have hypertension, we have to bring down our blood pressure to an optimal level and well-controlled level. Otherwise, our risk of getting stroke is very high. Right? Other causes, right? If you are a smoker, then better stop smoking because it contributes very high risk to get a stroke. Diabetes is another major cause. Cholesterol is another risk factor. And those alcoholism, severe alcoholism, drug abuse, meat consumption, and unhealthy diet, and also obesity also contribute the risk as a risk of the stroke. Now, what are the symptoms of stroke? Any part of the brain that control all the function in the body can be affected in stroke. Function of brain, we're talking about the motor activity, the power of the lower limbs, upper limbs, or all muscle groups. The brain also cover and help us in elimination, like bowel opening, urination, intellectual function, and perceptual alteration. Personality may change in stroke patient. There are certain part of the brain that cause stroke and become, making an elderly in particular become very change of a character, paranoid, disturbance, harassing behavior, will cause effect. Some will get depression from stroke, sensation numbness, and communication, unable to speak, unable to perceive what you're talking about. Now, these few words are very important. Be fast. Always understand what are the symptoms of stroke is be fast. So not only for us, but to remember this phrase for the people around us. So by means of be fast is balance. Whether there's abnormal gait, whether there's a disturbance of the visual acuity, there's a asymmetry of the face, whether the arms drooping, weak hanging, speech, unable to understand what they say, or people don't understand what we talk about. So this is speech. If we have above, act fast. Call 911 if any of us have experienced these symptoms. We elaborate bit by bit on these symptoms. Now, for example, loss of balance doesn't mean that we just feel groggy, but unexplained fall, in particular in elderly, doesn't mean the limb is weak. It can be a stroke. So don't assume it's arthritis. Don't assume that giddiness is nothing. It can be a sign of stroke. One side body weak and numb is quite obvious. Reduced sensation, it may be just part of the upper limb reduced sensation. It can be as subtle as that and can be a symptom of stroke. This is a very common symptom or presentation for elderly. Suddenly they cannot understand other people's words, or we can't understand what they say, right? Or suddenly loss of a memory. They can't remember the name, they remember the place, whatever happened last month, they can't remember because the stroke affect the particular part, a temporal, we call it, lateral side of the brain that in charge of the memory, right? And it can be irrelevant, answer irrelevant. We can ask him, have you eaten your lunch, breakfast today? He'll say, oh yeah. I have started to read about the book. You know, he can't understand what you say. He try to answer in different way, irrelevantly. Now, visual impairment, back part of the brain control the vision, as hospital area. Now, if there's a stroke over the area, they tend to have disturbed visual field, double vision, or poor vision. Swallowing difficulty, because we need a good muscle power in the swallowing part to swallow. If it's stroke affecting the muscle around that area, they tend to have difficulty in swallowing. They tend to get choked, even just a sip of water. More so if they take meat or hard solid food, they tend to choke. They have a slurred speech, indistinct. We can't understand what they say. They tend to have drooling saliva because of weakness over the oral cavity muscle. And there may be slanted angle of the mouth. You can see there is symmetry. There's a loss of the nasal, or we call it nasolabial fold, right? They even affect the elimination of our bowel or urine function. They may have incontinence. They have a vertigo, giddiness, headache, or emotionally unstable. So giddiness and spinning, it can be a sign of stroke. So be careful. Seek treatment early if you suspect so. What about the recovery chances? Now, these are a few statistics about the recovery chances. 10% of the stroke survivors recover almost completely. After a few weeks, they don't have any more symptoms, about 10%. Now, 25% recover with minor impairments. So I would say about 1/3 not so impaired, they still can function well, they still live independent like nothing happened before. However, there are 40% chance of them experience moderate to severe impairment requiring special care, right? And out of this, another 10% require a skilled care or long-term facility. They no longer can look after themselves. Family also can't look after themselves because they are too dependent on skilled nursing care. And some of them, 15% of them will die shortly after stroke. Now, what about 5-year survival of a stroke? Talking about survivor, those ischemic stroke tend to do better. They have a higher survival at 1 year and 5 years compared to those with a hemorrhagic or bleeding stroke. Having said that, the survival rate after 5 years for either one also not that great. It's only 31 and 24, talking about 29% of average survivors still alive, right? There's a very low survival rate for stroke. After hearing all these scary figures, the best thing is to prevent from getting a stroke. Now, keep the blood pressure, as I said. Blood pressure is the commonest cause and the main important cause. Control the blood pressure well to achieve the target level. Always remember that. If there's a diabetic, take the medication, take the insulin, make sure the sugar level is between the control optimal level. Lower the cholesterol if necessary with statins or medication. Now, those with the smoker, please stop smoking immediately because not only for stroke, you also contribute as a major risk factor for heart attack and cancer as well. Now, those with the heavy drinker, better reduce it and just drink in moderation. Eat healthy diet, exercise regularly, cut down all the sedentary lifestyle thing, avoid stress and obesity, have to reduce the weight, maintain a good healthy weight, right? And if there are those with the sleep apnea, treat the sleep apnea. So just to sidetrack a little bit, Missy Care, our sister company, Elderlove, have been running a nursing home and rehabilitation center for the last 8 years. We have treated successfully many stroke in terms of recovery, rehabilitation, at least to some extent make them independent to a certain aspect in their daily activities, because we adopt close specialist doctors monitoring. We have intensive physiotherapy in-house program, and also we combine with our affiliated traditional Chinese physician in terms of acupuncture recovery or treatment for stroke recovery. This is about elderly program. You can call us if there's any need. Right? So thank you for your attention. Thank you.